The U.S. has broken a COVID-19 hospitalization record as the Omicron variant rapidly spreads. According to government data, more than 142,000 people were hospitalized with COVID-19 on Sunday in the U.S. The vast majority of patients are unvaccinated. This comes as the American Academy of Pediatrics reports more than 580,000 children tested positive for COVID last week. Elise Preston reports from Chicago as schools there prepare for a return to in-person learning.
Late last night, Chicago teachers and city officials agreed to have staff return today and students return in person on Wednesday. Students have already missed 4 days of class, and by the time they return, will have missed 5 days.
Our goal throughout this entire process was to both get our students back to in-person learning as quickly as possible and prevent work disruptions.
The bitter standoff grew contentious and heated, but late Monday night, compromise won. The city and the Chicago Teachers Union agreed to establish metrics where individual schools will go remote if there's a COVID outbreak, resulting in percentages of teacher absences. There will be more thorough contact tracing and increased testing on staff and students. The district also plans to provide KN95 masks for students and staff.
It's not a perfect agreement. It does include some important things which are going to help safeguard ourselves in our schools.
While it's good news for the families of the more than 340,000 students across Chicago, more than 5,000 schools across the country have gone virtual since the beginning of the year. In Philadelphia, over 90 schools switched to remote learning due to staffing shortages over Omicron.
Yes, in the class for her to learn, but no, because I don't want her to get sick.
In Los Angeles, the nation's second largest school district, classes resumed today. But students and staff have to test negative for the virus. And so far, more than 65,000 tests have come back positive. For parents like Sharon Obsas, her child will be at home for the start of the semester.
He started having symptoms, and I did a home test, and he tested positive last night. He will be missing the first 10 days of back to school, sadly.
The entire teachers union will vote on the proposed agreement sometime this week. By the time students return, they will have missed 5 days in class. It's unclear if they'll have to make up that missed time. Vlad and Anne-Marie.
Elise, thank you. Pediatric airway surgeon Dr. Susannah Hills has more on the pandemic's impact on America's children. So, doctor, as we learn more about the effects of COVID-19 and the effects that it has on children, can you tell us what you're being faced with while caring for pediatric patients?
That it's important for people to not feel overly anxious about this variant, and we have to get through this in a way that makes sense. And one of those factors is that this variant does not seem to be affecting anyone as severely as the Delta variant. And so that's a good thing and should be reassuring. However, I think we have to really shift in terms of how we think about our children and our pediatric cases. We can no longer really think of COVID as a disease that's insignificant in children because we are absolutely seeing that children are affected with the Omicron variant. To be sure, the majority of kids that I'm seeing, the majority of kids that are being seen across the country have mild cases, without question, and it's often like a cold or an upper respiratory infection. But I and many others in hospitals across the country are seeing kids come into the hospital. We're seeing kids in our ICUs. Here in New York, we have had in the last few weeks over 570 children in the hospital with COVID. And that's not just children. A certain number of them, of course, are testing incidentally without symptoms, but it is not just children who are asymptomatic. Our ICUs are now having beds occupied by children who are extremely ill with COVID. So we have to really think about this particular variant differently, and parents really have to consider strongly, if they haven't already, getting their children vaccinated. We're still sitting at under 20% of kids in the 5 to 11 age range who are not who are fully vaccinated. So the vast majority of kids who are most vulnerable are unvaccinated, and we're seeing in our hospitals the kids who are showing up are the younger population, unvaccinated children who are at highest risk. So we can mitigate that risk by getting more and more kids vaccinated.
So, Dr. Hills, one of the things that's pretty interesting about what's happened in the wake of Omicron is that because of some of the things that we're talking about, right, that it is highly contagious, but it seems to be milder than, for example, Delta. Derek Thompson, who we've had on the show several times, has a new piece out in The Atlantic, which he sort of points out that a lot of Americans now, because of the squishiness of the messaging that has come out from the CDC and others, suggest that people are, after 2 years now, thinking to themselves, look, I'm fully vaccinated, I've received the booster, my children are vaccinated, I'm just going to have to make a decision to go out and just live my life. I mean, for the first half of the pandemic, where you had people encouraged, for example, by some that suggested that COVID-19 was not a big deal, right? You heard that even in the early days, that it was, nothing worse than the flu. You had a lot of resistance to that from most Americans. Most Americans decided to go out and get vaccinated and to receive their booster shot. Now you're seeing those people who have been in lockstep with the CDC, in lockstep with Dr. Fauci, saying, you know what? Enough is enough. I've got all the vaccines. My kids are vaccinated. Time to live.
I'm going to push back against that idea in this moment, though. And there are a number of pieces out there that are expressing a similar viewpoint, and I do understand it. I'm not going to push back against the idea of living your life. Of course, everybody needs to live their life. And I absolutely support schools being open. I think children should be in schools. I think we can do that safely. However, we're looking right now at a situation where over 700,000 people are becoming infected on a daily basis every day. We've got 142,000 people ending up in the hospital. It's a pandemic record right now. So we haven't reached the peak or the crest of the current surge. And I would push back against the idea that this is the moment to be, to throw caution to the wind and to disregard those measures that we've been talking about, that like masking, like being cautious with indoor gatherings. I think right now we have to pay attention to the fact that our hospitals are overwhelmed. Here in New York over the weekend, 40 hospitals were asked to stop elective surgeries because of the critical bed shortages we're having. And staff are out sick, testing positive with this virus from our hospitals. So we're having staffing shortages too. Oregon reported having only 42 adult ICU beds last weekend. It's a critical situation for our hospital system. So I think until we can get out of this moment where tremendous numbers of beds are being occupied by COVID patients, we have got to do everything we can to try to cut back on the number of people ending up in the hospital. And that number is going to be overwhelming as long as we've got over 700,000 people a day getting infected with this virus.
Yeah.
So this isn't necessarily the moment for that. I think this is the moment for caution. And soon, I think if indications from South Africa and the other information we have from the way it's trended globally are true, then hopefully we'll hit the peak and be coming back down in our case numbers relatively soon.
Let me just, Anne-Marie, before you jump in, I just want to point out that in Derek's piece, Dr. Hills, he does sort of point to the fact that 90% of deaths that we're seeing in hospitals are still from people who are unvaccinated, and that there is still another group, right? The group that is vax boosted and still cautious. And I count myself in that group, which is, and Anne-Marie and I have talked about this. It's been 2 years. I made it this far. I'm just going to keep going until doctors tell me we're good to go. Sorry, Anne-Marie.
No, I think you make a great point. And I was actually going to say that as well, that, there is a huge segment of the population that is all vaxxed up and is still masking and is still cautious about where they go and is I mean, after 2 years, it should be easy to keep up all this sort of stuff. And in fact, if people want to get back to sort of living their life, yeah, it's not maybe exactly the same, but you can do an awful lot of things if you also, continue to practice kind of the best practices of not catching the virus, which is something that Jen Psaki had to say yesterday. And she was specifically talking about schools and getting kids back in the classrooms. And, she was essentially saying, listen, you can do that as long as we incorporate these mitigating sort of measures. And I want to play a little bit of what she said.
What our position continues to be is that schools need to be open. We are on the side of schools being open. We believe that there are the mitigation measures, the steps, and the resources to do exactly that.
So this is something that I wanted to ask you about. One of those measures has to do with testing. And as I understand it, it's really hard to get your hands on tests. And some school districts have actually handed out tests. But it's not the same across the country. One of the headlines that I saw recently about these rapid tests had to do with, instead of doing a nose swab, which is what the instructions tell you to do, that you could get a more accurate reading by doing a throat swab. I want to get your take on that.
Anne-Marie, it's an interesting question that's come up. This actually started in some social media posts in terms of people talking about this, where folks were testing with a nasal swab test in their throat, coming back positive, testing in their nose, and the test was showing negative. These are the rapid antigen tests. We really don't have information right now to know whether the tests that we have available can be used in the throat, whether you can do an oropharyngeal swab with them. But, it is possible, and there are 2 studies that are preprint, so they're not out yet to the public. They're not yet vetted. But there are 2 studies that may indicate, in very small test populations, by the way, so they're not very rigorous studies, but possibly with the Omicron variant, the test may show up positive in saliva in the oropharynx a day or 2 before they turn positive in the nasopharynx. Again, these are 2 very small studies that haven't been vetted yet, so it's certainly unclear whether they will hold any weight in the scientific community and get printed. But the tests have been FDA approved for nasal swabbing, not for oropharyngeal swabbing, and that's really what they're intended to be used for. And certainly what I think I and other physicians around the country would recommend that people do, that nasal swab as opposed to the oropharyngeal swab.
Yeah, and I've seen, Anne-Marie and Dr. Hills, that, doctors are cautioning people sticking swabs in their throat because you might throw up. It's just a little bit more delicate, going down the throat than, swabbing your nose. So just something that people should be aware of. But I want to ask you before we go about this report that Pfizer's CEO says that they are aiming to have a vaccine for the Omicron variant available by March. So should the focus be on vaccines for new variants? Because we have been told, we understand that being vaccinated, I received the Pfizer vaccine. I know one of my friends received Moderna vaccine. My wife received Pfizer. We should be somewhat protected from all variants as long as we receive the booster. Why create a specific vaccine for a specific variant, given that we may have more variants down the line? And it appears that Omicron, while contagious, isn't as deadly as perhaps Delta.
I think you make some really good points, Vlad. I think that the key point you just made for people to take home is that the vaccines that we're currently giving, that we have been giving, do confer some protection and would likely confer protection to some extent against any variant that would show up, more than likely. Yeah, there's a possibility of some super strain that shows up, but more than likely it would confer protection against other mutations, other variants that show up. And we have really good evidence just from looking in our hospital beds that people who are vaccinated and boosted are protected from this Omicron variant as well. We're also reaching right now, hopefully in the near future, a peak to this Omicron situation. So then if vaccines are available for Omicron in March, but the peak has passed, or if most people who aren't vaccinated have been exposed and infected with Omicron and do conceivably have some protection from that, then I'm not entirely convinced of the utility of asking everybody to do another vaccine against Omicron specifically. I think if the main goal ought to be to get everybody vaccinated first and foremost. And I don't think we're going to have much traction in asking people to continue to get vaccines for every mutant that arises. Now, it is very possible that, like we do with flu vaccines, we could do a yearly annual vaccine for the coronavirus, and that could be adapted on a yearly basis to target some specific strains that seem to be most prominent at that time. So we could have flexibility down the road. But I think right now asking people to do multiple vaccines for every variant that shows up within 6 months or a year is a difficult request.
Yeah, for sure. Dr. Susannah Hills, always great to have you. Thank you so much for your analysis and your clarity. We appreciate it.
Thanks, guys.